How much responsibility do you have on your first placement? Does it change as you go through the 6 weeks?
I think it depends how you define, or whoever's asked the question is defining responsibility. But essentially, I think the primary responsibility really for your first placement is just to ask lots of questions, get stuck in, be professional, and kind of take the lead on your learning and your development. If you have any responsibilities above that, if your PE wants to trust you with leading a session or kind of taking the lead with a client or a patient, then I think that's a bonus. But I wouldn't worry too much about level of responsibility, because ultimately as well, your practice educator is clinically accountable. So just kind of really take responsibility for your learning and development, but don't try to worry too much about anything else.
Lovely, thank you. Bianca. Did you
Yeah,
have your hand up?
no, but I can contribute quickly. I agree with Laura, and also my placement was a bit different. I kind of got quote unquote responsibility after 2 or 3 weeks. I was left alone with a patient who did their own personal care, but I only was alone because they were getting ready to be discharged anyway. So it was just very minimal. It was just to make sure that they didn't fall, that if they needed help with anything, I could just hand it to them. But as time went on, it was a lot more responsibility with helping with certain areas of personal care. But it all depends on you and your PE and how comfortable you are, essentially, because it is your first placement and it's just a learning experience.
For my placement, it was kind of essentially, I don't know, it felt like more of a observe kind of thing. So wherever we went, I was with my practice educator and I was observing everything, asking lots of questions. But mainly, my practice educator was really good, and she was like, "Do you feel comfortable in doing this yourself?" But she never left me alone. She was kind of always there, unless towards the end of the placement, she was just said, "Hey, do you want to go and do this yourself? Do you feel comfortable doing it? Do you want me there? Do you want to do it?" So it was a lot. There's just a lot of communication. So
Yeah.
And I would say if you don't feel comfortable with doing it, if they do ask you to do something, just say, "I'm not quite comfortable with that yet. Could you come with me, or could I watch you do it again?" So yeah.
Hannah, sorry, I didn't see. Did your hand go up?
Yeah, no, that's fine. I'd echo what everyone else has said, I think. And the kind of last thing I'd add is just that initially when I was responsible for different tasks, they'd give me tasks that kind of weren't the end of the world if I got them wrong. So they're not going to like give you for your first task something that if you get it wrong, it's going to cause chaos.
Yeah.
So like some of the first tasks I started with were drafting up initial OT assessment notes after we'd both been to see a client together. I would write up the notes, and then my practice educator would look at them and be like, "Oh, can you add this?" or like, "You've missed this." And that's not the end of the world if you don't get it right the first time, obviously. So,
yeah, absolutely agree. So is placement 1 mostly shadowing, or do you play more of an active role in the team?
For me, they thought that like I needed to take more of an active role. I think also the fact that we're master's students, they do expect differently from us than BSc students. So the first week, I'd say the first 2 weeks for me was mainly observational, and then after that I was like right into it. Like actually not even the first day I went and did a kitchen assessment in the afternoon, and I had to write soap notes just based off of what I saw and try to like, they were challenging me from the minute, but I told them that I wanted to kind of just see what was happening first, but they didn't slow it down at all. So I didn't mind. I just jumped right in. And like Abby said earlier, you got to be flexible, because I was put on different wards and I didn't know where I'd be. In the morning, I just show up and be in the wrong place. They're like, "No, you have to go to the other place." So I just have to like run back and forth. So yeah, just not knowing things, not that uncertainty, but you just get used to it. And 6 weeks, it'll go by really quickly. Next thing you know, you blink your eye and you're done. So,
yeah. Ben, did you put your hand up?
Yeah, I mean, for me, it was really interesting, because I was expected to take an active role, but I also remember my placement educator really wanting me to kind of just actually step back and observe all the things going on to start with. And I was kind of almost very ahead in the idea of wanting to do probably more things I actually should have wanted to do.
Yeah.
And I always remember her going, "No, just kind of, you're not quite at this stage yet, even though like you have the right ideas. you just need I just want you to kind of watch what I do and kind of observe what I do and just kind of take all of that in before you start trying to do all these things yourself, because you're essentially here to learn, not here to actually do the job. And later down the line, we can start actually getting you to do take more and more of an active role.
Yeah, absolutely. I think I experienced quite sort of the same first placement in the John Radcliffe, although that was one of the sort of post-COVID, not post-COVID, but still in COVID, one of the emergency like NHSP ones, can't even remember what it was. So we were really thrown in at the deep end because we were actually employed. But then the second placement, in terms of responsibility, there was definitely more sort of, being out on your own. Yeah, Abby.
I can just add in like a quick thing is I found it depended on who I was working with as well. So I had 2 PEs, and so one PE was more got me involved a bit more, and the other PE had me observe a bit more, which was useful. There was points that the one PE that had me observe more, one of the reasons is because she worked part-time and she didn't work with me very often. So at points I felt like she was holding me back because she only worked with me like once a week. And so on week 4, she was still treating me like it was my first week of placement kind of thing. So just be aware of that when you are on placement, because your PEs will both have kind of, if you have 2, will have different approaches. And sometimes you might have to advocate for yourself a little bit more because, yes, we are there to observe and shadow. But sometimes you do have to get your hands in there and try it yourself without feeling like your PE is constantly going to interrupt and take over, which can be really frustrating and something to be prepared for. But it's really hard for your PEs to not sit in the driver's seat. And that's something I think was probably one of the most frustrating experiences for me, where they would say like, oh, we want you to lead this. But then within the first minute, they were interrupting with their own questions. And so it becomes super hard to try and do it on your own because they're trying to take over. And so then it's just a good thing to reflect on afterwards and discuss. But yeah, it is quite dependent on who you're working with. And if you're on a team, sometimes you're working with multiple different people every day. And some people have you do more things and some people have you do less things. And it's just very dependent. So, yeah.
Yeah, absolutely.
Yeah, I kind of try to view it as kind of the idea that she was the fully trained OT and I was the assistant. So like not just actually just a student who didn't know anything. We kind of had an almost equal role to play in whatever situation we were in. And there were some roles where like it generally did actually feel like that. It's like when she did actually kind of step in and kind of cut me off or kind of start to take like more of the kind of driver's seat, it didn't feel like wrong or frustrating. It just kind of felt that's what would happen in this situation.
Yeah. Thanks. Thank you. We have slightly touched on this. So question number 6 is, how much were you expected to do in the first few weeks? How much supervision did you have? Nafisa?
So because I also had 2 PEs like Abby, it was quite hard to coordinate, but we tried to do it weekly. I think one of the weeks it didn't happen because they were both off. So it happened into the week after. So it was kind of a bit sporadic. Like it was like either happened or it didn't happen. So it was quite hard to coordinate, I'd say, for me personally.
Thank you. Hillary?
Yeah, I was the same. We were supposed to do it every week, but like as Abby said earlier on, like things happen and you end up missing it, and you're supposed to do it at 10 o'clock and then you get a new client and you end up doing like their assessment goes on longer, or it just kind of happens. Like you kind of aim to do it once a week, but sometimes we missed a week, we had to do it like Monday morning first thing, or then you have another one quickly then Friday. It just depends on the weeks from the actual side of it.
Yeah. Abby?
My PEs, despite like how disjointed my first few weeks were very on the ball for supervision. And like even I'd have days where my PE would be off in the afternoon, but she'd call me and we'd do supervision over the phone. So I was very fortunate on my first placement to have really consistent supervision. And it was really helpful just to help me figure out goals for the next week and how I can like move myself forward rather than feeling like I'm kind of stuck in the same spot. And because I had two PEs, it was helpful for my PEs to read the supervision notes. And so then the PE that I didn't work with as often could see like, oh, I saw that this is what you want to work on this week in your supervision notes. And so it helped guide our relationship a bit better.
Yeah. I think in terms of preparation for supervision, it took longer to prep for it than it did to actually have it. But similar to you, Abby, my PE was very hot on supervision on my first placement. But I would say also to the first years, I would say to really read that handbook. You don't get given it just for fun. It's actually really informative. And even though there's sort of just a certain amount of reflections that you need to do, reflect as much as you can, because you don't have to submit each one, but it does evidence your learning. But it also means that in terms of if you've had a very difficult patient or difficult relationship with somebody within work, you don't have to necessarily take it home with you.
Okay, so for my placement number one, I think the very first day of my placement, my PE actually sat me down and she talked with me and she said, these are the things that we need to complete for your placement one. Would you prefer to have more of a shadowing role, more of an interactive role? How comfortable do you feel doing these things? And so we had a conversation about what I was comfortable with doing. So for the first, I want to say week and a half, it was a bit more of a shadowing role. I watched what she did. I was able to sit in on quite a few of the assessments and things that she did. And then about halfway through week 2, I started taking more of a, I wouldn't say leadership role, but I was inserting commentary. I was helping out with assessments a little bit more. I was helping to fetch clients to and from the waiting room into our actual room. So she was giving me a bit more responsibility. And then by weeks 5 and 6, she was still in the room with me, but she was letting me begin some of the assessments. And then if I missed anything, she would obviously say, oh, well, we need to make sure that we're asking this as well. So that was kind of how my experience was, is it started off very shadowing, but because I had talked with her, I was able to participate a little bit more in a way that I felt comfortable.
Okay. Yes, Ree.
I would say mine was similar to that. So I didn't do anything on placement 1 that I was uncomfortable with, but I did get to do by the end quite a bit. I wasn't one-to-one on my own with any clients, but I got to lead meetings and I got to lead parts of consultations. And I drew up a bathroom plan that went straight back to the client unaltered. That was my that was my most exciting thing, really. So it was such a new skill for me, and I was so pleased.
Try to shadow as many people or as many different kind of MDT people that are there. Ask your supervisor. A great way is like during supervision, say, hey, I would really love to shadow, say, the physiotherapist or, a doctor if you can, or see a surgery. Like if you're in a hospital, on one of my placements, I was able to kind of shadow a surgery. So that was really cool and useful. But I just say, try to follow as many people as you can so you can see how everything kind of works together.
Yeah, absolutely. Shadowing a porter was my favorite. Really helpful to know exactly how much they have to deal with, and I mean they know the way around the hospital so well that they teach you all the shortcuts. So how much were you expected to do in the first few weeks? How much supervision did you have?
So we had supervision. I mean, supervision was always like once a week, like a official supervision was once a week. But I would say that there was kind of supervision on a daily basis. I mean, what you're expected to kind of do in the first week is observe. And then my practice educator had me like write notes. So practice on writing notes after we've seen a patient, trying to get everything in there. And then we would talk about it and we'll go over it. And then, I mean, just kind of throughout the day, it's all about, do you have any questions? Things like that. So I would say, yeah, official supervision is once a week, but it's pretty much kind of throughout the whole process.
Was once a week pretty standard for everyone else?
Yeah. But like Naomi says, I think you get feedback all the time, which is really helpful. But also the one thing I'd just say about supervision while we're on the topic is that it's so important to direct those sessions yourself. So come to the sessions knowing what you want to talk about. I mean, I think there's some forms that are really helpful to do that anyway, but know what you want to talk about from that previous week and which bits you think you did really well and which bits you'd like a bit more feedback on, because that shows that you're really proactive and you really want to learn and listen to your practice educators as well, which they always really like, obviously.
Those supervision forms are a godsend. I think I said in one of the other groups that I spent longer writing those supervision notes than I did, I think, in supervision. But they're great to use when evidencing your work when you get to that point.
So my first few weeks, I did a lot of shadowing mainly, and sort of as the weeks progressed and I felt more comfortable, they gave me more and more responsibility, but they never gave me anything that they think I couldn't handle, and they'd also reassure me to make sure that I felt comfortable as well. And because it was a sort of a slow progression, it didn't feel like I was being jumped into anything. So after a few shadowing, they'd let me sort of take over a bit more in the session. And then sort of by the end, I managed to go out by myself to people's houses. So it was such a slow progression. It didn't feel like ever I got jumped into anything that I wasn't prepared for. And I definitely feel like the practice educators, again, they just make sure that you're comfortable the whole time.
Quite similar story, really. My first couple of weeks was a lot of shadowing. You're with your placement educator or someone else and you're observing what they do, and then it progressed into sort of okay, next week you're going to take this patient and do this with them. This is what you need to do to prepare. And my placement educator was there through it, and so then could add things if I'd missed anything out, or and so sort of supervised in, and then you kind of go from there. But I was the same. I never was put in any sort of interactions with clients that I felt like I wasn't ready for. And if they said, oh, you can do this one on your own, but I hadn't done that specific thing before and didn't quite feel ready, I could say, like, can you just attend this one just to make sure I'm doing it right? And they did. Like, I felt very supported in that sense.
Thank you. That's really good to hear. And Linda?
Yeah, really, just from a virtual placement point of view, pretty much the same as Hannah and Georgie have said already. Lots of gradual easing into dealing with clients. So although I was dealing with them over the phone, it was pretty much the same. We had a sort of triage team, and initially it was just a case of listening into the calls, how everything was dealt with. And then as I got more confident and had those discussions with my PE, it was a very gradual thing of starting to take the course, the service user myself. But very much my PE was very supportive in terms of checking that I was comfortable doing things, and I could ask lots of questions and sort of go back. And there was always that understanding that, you know, if I didn't feel comfortable with something or wasn't certain, just to go back and ask more questions or decide not to do it. So yeah, very, very similar in that way.
I mean, in the first few weeks, I suppose, again, it's slightly different in our setting, in our farmability setting, a bit more relaxed. But I definitely took the first few weeks to I suppose I squared it in my head that obviously I'm a student on placement. This is a completely new environment. I think it's time to basically just kind of imbibe what's going on, try and figure out how it works, what you think works for people, what doesn't work for people. So I think in the first few weeks, basically that they were also the practice educators and the people work there know that it's your first placement. You're just settling into being on a placement, being sort of hands-on clinician, I suppose. So I think they're fairly lenient with you for the first few weeks. In terms of hands-on work, they were really good at farmability, at giving you as much as you wanted. So they would ask if you wanted extra responsibilities, if you wanted to work one-to-one with a co-farmer. So I think basically they were happy to let you take on as much as you felt was sort of you were able to take on as comfortable kind of thing.
No, definitely. That's a really good point, actually, that practice educators are very flexible and they will say, you know, how much can you do and how much would you like to do? And definitely at Farmability, they were so accommodating, for sure.
Yeah, for sure.
Okay. Do you ever get left alone with clients early on? Bianca, I'll go to you first.
So I had an extreme case where I had to be left alone with a patient while they got help for a patient who had passed out and they needed to get the team in. And then quickly I was surrounded with nurses, so I wasn't alone for more than maybe a couple seconds. But I noticed that as placement went on, I got to be alone with patients more often. But like I said, it was with patients who were very independent and didn't need as much help. But if it was someone who needed more help or was in a case that I wasn't familiar with, I always had someone around, whether it was an OT or a PT.
Yeah, thank you. Hannah?
Yeah, very similar. So my first client visit alone was I think week 3 or week 4, but prior to being with that client alone, I was on a community placement, so it was going to their house. Prior to that, my practice educator came with me to visit them together, like introduced me, and also very much what Bianca said, they wouldn't leave me alone with anyone or send me to visit anyone that they thought were, you know, particularly risky or anything like that. So yeah, I always felt very safe when I was out there alone as well.
Thank you. And Laura, you put your hand up.
Yeah, I'd echo what everyone else is saying, and I think it depends on the level of clinical risk, but also on kind of what you're comfortable with and what your experience is. You know, if you're a master's student and you're coming into the degree having worked in clinical settings before, you're probably more likely to get left alone a bit earlier on. But yeah, they're not going to leave you alone to do anything drastic. They're not going to leave you alone to do like a full assessment, a full intervention. It'll all be proportionate.
Does anyone have any tips from personal experience of dealing with clients who may have been resistant to engage with you because you're a student? Ellie?
One of the tips that I would give is definitely be willing to advocate for yourself and kind of be able to say, I had a few individuals who they were really expecting experts in our field, which is understandable. And so walking into a room and seeing a student, they were like, well, I don't really know how comfortable I feel with this. And so I was able to advocate for myself and say, well, this isn't my first week. I've been doing this, this, and this. Obviously not giving details on patients, but I do have a bit of experience and my PE will be here. So you will still be getting the expertise that you are expecting because she will be with me and ensuring the quality of care. But this is, I do know what I'm doing. And also talking with your PE, if you ever have any experiences, they might be able to give some pointers or help guide you through some of the situations.
Thank you. Yeah. Actually, from the other groups, it's been really interesting listening to people's reflection on this, because it's been sort of, in my experience, it was more the family members who would have the doubts than the patients. So yeah, it's like navigating yourself around that can be quite interesting. The anchor.
I can take it. So
Thank you.
they weren't resistant, but sometimes they were hesitant if I went in alone. So what I tried to do was kind of go in and pop in whenever I had a break, or if I finished lunch early, kind of pop in and have a conversation with them and build almost that like therapeutic relationship with them, like we learned in class. So by the end of it, I'd be like, hello, Mr. So-and-so, how are you today? Good, okay. And then I'll be like, do you want to do this? And then they were comfortable enough to be like, oh yeah, that's fine. So it's just really having that time to get to know your patients, because you are a student and it is nerve-wracking and they're putting their trust in you, who you're learning. So kind of keep that in mind, that your patient isn't sure how much you know or don't know, and they're hesitant. So build that therapeutic relationship, get to know them, what they like, talk to them. They're kind of sitting in a room bored by themselves most of the time anyway, especially with COVID. So I found that communicating with them helped me build that relationship so that they can trust me, even though I was a student.
I love that you took the time to, you know, in your breaks or whatever, to just go in and have a chat. I think building that therapeutic rapport is just, it's so important.
Yeah.
And just being creative with what you can do with your time.
Yeah.
I think in my experience, I didn't have a patient who felt like that. But it was actually the family members. So when I had to contact the family to update them, it was them who were, oh, but can I get a second opinion? You're a student. You're like, okay, it's my PE. But that does, you build your confidence over time, don't you? Do you have any tips from personal experience of dealing with clients who may have been resistant to engage due to the fact of you being a student? Bryony.
I've personally found that most patients are really enthusiastic about students seeing them, and I have not yet met a patient who is reluctant to have a student even watching and observing. Most patients are really, really keen for you to get involved, and especially some patients, they want you to learn. They're excited to see you learn, and they enjoy the fact that you're talking to your practice educator at the same time about things that are going on with their care. And it's really exciting getting the patient joining in with your learning at the same time, and it becomes this amazing group discussion. So personally, I have not found that, and this might be different for other people, that service users and patients don't want students involved. I've actually found the complete opposite of this.
That's really lovely. Jana.
Yeah, so I was gonna say I haven't really experienced anything, and I thought that maybe be like working on the hyperacute stroke unit, I'd have a lot of people who are reluctant of having a lot of people around them or something. But even people with strokes, people who do have some form of either physical deficit or cognitive deficit, they're so excited for everything. Like they genuinely enjoy, and they do, like they get excited, as Bryony said, when your PE is trying to explain something for you, and they're always like, oh yes, you have to learn, don't worry about it, do you want to feel it, do you want to do? And I thought that was really nice.
Thank you. Imogen.
Yeah, I'm just going to reciprocate the same thing. I've not experienced anybody being resistant to you as a student. Your practice educator and yourself will always introduce yourself as a student, so, and gaining the consent, or is it okay if I watch? And yeah, they're always really keen for you to enjoy, and I've had a lot of people say, oh, good luck with your training and that kind of thing. So I think they're all just really positive, and I haven't experienced any negativity around being a student at all.
That's just so positive, and shows how supportive the environment can be as well. Just expanding a little bit on that question. So the patients were, you all had a really great experience with the patients. Did any of you have any encounters with family, like having to update or contact family like over the phone, really, because you probably couldn't see them in person? And did they have any concerns, or did they want to speak to your PE or, you know, line manager? Imogen.
Yeah, all the family members I've rung, again, I am saying I'm an occupational therapy student, And so far, no, I haven't had anybody be like, oh, I'd rather speak to somebody else. In the setting I'm in hospital in acute general medicine, so they have contacted doctors all throughout the day. So yes, they hear from the medical side of things, but from the side of things that we are, they've really trusted the updates that I've been giving, and I haven't yet had anybody asking to speak to somebody senior to myself, which is really, really nice and shows that they're really trusting. And because obviously it's so hard at the moment that they can't see their family members, and they're having to trust what you're saying over the phone, and they're hearing from so many other people. So it really shows that, yeah, people are really trusting in you, and that's really nice.
Thank you. Brian.
Yeah, so I'm working on neuroscience ward, so the acute ward as well. And most people can't come in, but I did actually have one mother of one patient who came in because the patient had learning difficulties. So they were allowed to visit for 1 hour of the day, and I was able to speak to them with a physiotherapist, a band 6 physiotherapist. And I found that they do treat you with the same level of credibility. They don't ever question, oh, your sources or your credibility like this. They've never asked, even the people I've called, they've never asked to speak to somebody senior than me. Because people are so desperate for information and anything, especially with discharge and how difficult it is not being able to see their family, and it is difficult for the wards to always keep everybody updated. People are so desperate for information, and they're not going to pass down any information that you give them because you're not qualified. And I think as well, because we're students, we go through things so thoroughly to get it right, that we're giving such a detailed level of information that, not saying that other therapists wouldn't do that, but I found that I've given so much information and I'm almost overloaded with information in fear of leaving something out. So I've definitely found that a lot of them are grateful for how thorough I've been being a student as well.
Imogen.
Yeah, just to kind of add on, and as therapists, I feel like, especially in hospitals, we have a bit more time to kind of spend with the patient, and to take that time to spend half an hour on the phone to family members, whereas the staff on the ward just don't have that. So I think they're just so grateful to be getting that kind of in-depth kind of update on how their family members are doing, because they're very understanding that ward staff don't have that time, whereas we have a bit more time to be able to do that. So yeah, they're definitely really grateful to hear from us, even if we are students.
This person has said, I would like to hear some examples of where people went and how, if they applied what they'd learnt in the course so far. Hannah?
So I was in a community mental health team. So my practice educators were the only 2 OTs in the whole team. It was a really big team. We worked with like psychotherapists, psychiatrists, social workers, some staff that were like responsible for getting people back into work and things like that. So I found my knowledge of other professions actually a little bit helpful, just very basic knowledge of kind of what people do. And also just in that particular setting, MOHO was particularly used, and assessment methods in that as well, although I didn't know much about them beforehand, so it wasn't essential to know. But I definitely found the biggest thing, a bit like Bianca said earlier, was the therapeutic use of self stuff, and just building relationships with people, because you're not expected to know every single intervention under the sun or every assessment method ever. It's more about building relationships. I think maybe more so in mental health, I'm not sure, but yeah.
Laura?
I would just say, I think a bit similar to what Hannah was saying, I was in more of a medical setting for my first placement, so I definitely found that I was using a lot more of my anatomy and physiology knowledge particularly. And also, kind of, if you're going to be going into that sort of placement, be prepared to not know what on earth a medical condition is and have to research it. I spent so many hours on like Google Scholar and all of the different NHS websites Googling what a particular medical condition was. But ultimately, think obviously your theory will take you so far, but you need to treat the client as they present and, you know, how they are in front of you. So just remember that as well.
Yeah, definitely. And also people use a lot of jargon, and, you know, that jargon, we don't necessarily learn that in uni. That's, I think also, like, the NHS is very different from other healthcare systems all over the world. Therefore, our acronyms are all different too. So I would definitely advise going on to Google and just looking up NHS acronym or terms, and SOAP notes. Do you have any tips on managing your workload with the long weeks of being on placement, plus the coursework and reflections, etc., that you need to also do?
Well, I personally set aside an hour at the weekend, but only really an hour, whatever works for you, to go through things like supervision and also reflections, bit more than an hour, and you know, just to make sure that I was prepared for the week. I knew when supervision was going to be. I'd kind of made documentation of what I had done previously in the week to achieve competency, so I could kind of cross-reference those with my supervision on the weekend. So that really helped for me to be prepared for the week, and also manage the workload essentially. I like to be prepared, so I kind of put the forms that we needed and the work we needed in kind of order on the Google Drive, so I knew what week I had which assignment coming up, or you know, which paperwork needed to be done. So that's what kind of kept me on track throughout so far.
Thank you. And Linda?
Yeah, I just echo that in terms of being prepared. So just staying on top of your paperwork, your reflections, your supervision, finding a system that works for you, whether that's keeping paper folders or on a Google Drive or whatever. A couple of things that I found really useful. So one was creating a shared drive, which my PE had access to. So as I was working on documents or when they were completed, I didn't have to worry about sharing them, emailing them. They were already on there. Also, another thing was I kept a daily activity log, which meant that when I got to the end of the week, those reflections and that supervision report, I already had lots of material for it. Because it's so easy when you get to the end of the week to think, what have I actually done this week to meet this criteria? It's so much to think back on. So that was really helpful. And then the other thing was there were a few of us in the settings. So we had a peer support group and we met up once a week. So we were able to sort of share experiences and you know, vent a little bit if we needed to. Not that there was really much of that. We all really enjoyed our placements, but also share tips that worked in that particular setting. So those are some ideas that I found really helped.
They're great, thanks. Georgie?
I was going to say sort of similar actually to Linda.
Oh,
I definitely felt sort of, yeah, writing down, even just like it only takes sort of like 5-10 minutes after a day just to jot down what you've done. I found that really helpful. And then just having that sort of list you can go back to for when you're preparing for supervision, I definitely found really helpful.
I think I said in pretty much all of the groups that I reckon I spent more time preparing for supervision than in supervision, which is, it's a good way to have it. It's a good way around to have it for sure. But it's definitely true.
I'd say, at least for me, I usually just, after the workday, I would just immediately write down everything that I did during the day, anything that I've never done before, and then just write down how it went. So that I just have something to look back on for supervision. So my supervision was pretty much just like, I just pick out key little areas that I've written down during the week to like bring to and discuss about it. So I don't know, it really depends on how much is done on the day. So, and it, yeah, because if you do more, you're gonna have more to write down. But yeah, otherwise supervision for me, it didn't require too much prep work if you just keep track of what you do every day, and then you just have it already there. You just like, oh, okay, just summarize it quickly, and then you go over it with your PE at the end of the week.
That's useful advice. Really good tip. And what about you, Seamus? How many hours a day or a week did you spend on evidencing your work?
I'd say outside of placement, spent like 2 hours a week. Like outside of placement, but like I had enough free time during my placement, like the end of the day, or like if we had some like lull periods where I would do like a reflection, or prepare for my, recommend keeping a journal of what you do every day, and you know, you use that journal while you're on placement to like make a plan for the day, and then also reflect on the day. And it's really handy having everything there in that one place, so that when you are doing your reflections, you can say, oh yeah, I did that on that day. Because if you just like try to keep it in your memory, you're not going to remember it. And so I'd recommend doing your reflections like don't save them till the end. Do them throughout your placement.
Yeah, and the in terms of reflections, like just from my experience, I mean the handbook, it guides you on sort of how many you need to do, but I found that every time I had a difficult interaction with a patient, or if a patient, I don't know, if something happened that sort of was going to keep me awake at night with worry, like I'd write an extra reflection, and it did really help. And I didn't submit all of them at all, but it helped sort of my processing and like my general well-being. I found that really helpful.
Basically, the way that my placement worked was we had a number of different service users throughout the week, and it would be a morning session, then an afternoon session, and it'd work sometimes because of COVID, it'd be smaller groups in different types of sessions. So after each day, I'd make sure to write down a note of what happened in the sessions, what I thought went well, what I thought could be improved, and sort of a bit of a profile about each of the different service users, or co-farmers as we called them at Farmability. And I think that doing a little bit each day makes it less of a burden. So I'd say probably maybe about half an hour, 20 minutes in the evenings once I've finished to write a bit of a diary.
Yeah.
And then so you have, I think you either have a half day or a full day off to prepare for assignments, which I definitely admit, I think I used quite a lot of mine to de-stress, just to sort of relax into things a bit. I think you got to take a bit of you time. And I think, so for some of that, when you knew that there was a supervision or something like that coming up, you'd use your time a bit more to get into the nitty-gritty of things.
Yeah.
But I get maybe sort of 2 hours on those days, on the days that you have off, or the time you have to study. And I think sometimes, well, we definitely did at Farmability, had a bit of extra time if we needed to go off and prepare, which is really useful.
Yeah, I was just about to say, we were really fortunate if we needed to catch up on work that is like needing to be submitted ASAP, then they were really accommodating, weren't they? And just said, yeah, just like take the morning as an office day, or they're really good.